All right, let's call this meeting to order of the Health and Human Services Board meeting on January 7th. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman, Marshall Savitsky, Chuck Van Etten, Jeff Haney, Bill Trepanier, Don Pettit.
Here.
Virtual, Carol Pearson, and Dr. Sabrina Dunlap. You have a quorum.
Thank you. Pledge of allegiance, please. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The agenda has been set. Are there any public comments? All right. Let's consider approval of the minutes from our previous meeting.
I'll make that motion to approve the minutes.
Motion's been made and seconded to approve the minutes from our previous meeting. All in favor?
Aye.
Opposed? Motion carries. Committee reports. Are there any reports from LCO? Are there any reports from the Senior Resource Center? Administration. Andy, do you have anything?
I do not have anything.
All right. Moving right along. Adult long-term care.
Okay. Carol has put together a full report for us for the adult long-term care unit. We are still fully staffed in that area, still keeping busy with referrals coming in, and a number of activities with the dementia care specialist, having powerful tools for caregivers and the brain checks and that type of information. And I should be moving myself along here. I got to get used to doing both of these pieces. The one update from that it would be good to make note of is Mary Wolf is returning as the LCO Elder Center Director, and Allison Cuddy is moving back. She was interim and is moving back to DCS and INA specialist. Otherwise, everything else is pretty clear in that report. The other report that is in here, I'm just getting to, hopefully I'm not making people sick through this, is an overview of the 2023 Benefit Specialist Programs fact sheet. And just went over a number of areas of people that that the benefit specialists have touched, the number of cases that we're seeing rising. So it does help us understand why we're feeling so busy, because we're seeing that happen throughout Wisconsin and not adding more staff. So they're definitely starting to feel those pinches there. And then a few different stories about the successful programs. Any questions for adult long-term care? Okay, moving on then. Are you ready for me to move on, Kay? Behavioral health report. Alicia has provided a report for us for the behavioral health services. Is there anything in addition you would want to add to that? It's been a little while since the report's been out. I think the big thing is we are in a bunch of transition, trying to kind of move forward with Joe leaving, and where do we see our services and planning for the future, and how does that look for supporting the Chapter 51 in emergency detentions. So one of the things then that's outside of that report to kind of report on is this is the first week that Joe is officially not here. So we will be working through and muddling through, I'm sure, some things that were unexpected. Just even faxes that are coming in. Alicia sent one like, oh, this is something that Joe would have normally gotten versus her. And, just kind of working through some of those things. We are working with Duffy's office to help contract for services so that we can be supported through that Chapter 51, especially with the court hearings and the commitment and making sure we have all of our ducks in a row. And Joe will be helping to support through Duffy's office to do that transition until we can get somebody else trained in. So I'm envisioning it being, a 6 months time period to really understand all of those pieces. What are we missing? What do we need? How are things working with the calls going directly to Northland from law enforcement and all those types of things? So any input would be beneficial as we move forward, and looking at Marshall because he'll probably hear about more communication things than anybody along the way. But we're doing the best we can to anticipate the needs and then moving forward from there. The other thing that's in here is our mental health by cost report for the monthly expense report. Nothing outstanding that is not expected. And then we have the mental health cost by client report. And as noted, I think in previous meetings, I have mentioned that really our goal for this year would be to take a look at a couple of these to see if there's maybe an RFA that we can do or RFP that we can do to look for a proposal of potentially finding more value in the placements that we have. As you can see, a few of these placements get to be quite expensive for us. Okay, I look at this correctly, should finish our behavioral health area. Does anybody have any questions for me or for Alicia?
Why would we land that transportation?
Oh, well, Alicia doesn't have the answer to that, but I did want to talk about that a little bit. I know they're working on transport things. At Marshall, I think you might be like working with the sheriff on kind of filling in the gap. I don't know if you have anything you want to say. I have just something to say about a transport company, but.
Tomorrow we're all meeting, community partners meeting at the sheriff's office and the hospitals involved in Health and Human Services, I believe too. And that new business that's starting in Spooner, that it's a transport company and a brand new one, a local person. He will be there to present to everybody, all the stakeholders, I guess, to see if he's going to meet the criteria we need for secure transports and such. So I think we'll know more after tomorrow.
And
But,
I can report, I can bounce right on to that because we actually used them for one service. We needed to transport a youth and needed to transport quickly. It wasn't on detention, but it was like a mental health transport type of thing. And they worked really well with us. They were very responsive. In fact, we were anticipating we wouldn't get service till the next day, and we were able to get it same day. I got text messages of where they were at along the way and safe transport pickup and everything. So I was really happy with the service that we received, and the cost was pretty good too. So anyways, we'll see. I'll be curious to see how that goes. I won't be able to attend that meeting tomorrow, but thank you, Carol, for bringing that up because I had it on a little sticky note to mention.
Can you bring the report then to us next month of that meeting? Thank you.
Okay, anything else in this area? Okay.
Next would be Child Protective Services and
Thank you
Youth
for helping.
Justice.
Okay, I am going to go ahead and ask Sarah to jump in here. She's got her two reports, her standard information, but I think she has some other updates of things we've been working on.
Yes, so the first thing I want to report on is some of you may have heard that a little over a week ago, one of our juveniles was shot. I know I've been talking about the gun violence picking up in the community, and the worry that I had that it was going to turn into something like this, and it finally did. Luckily, this juvenile is going to survive. He was driving and shot in his arm and his face. The bullet got lodged in his tongue. So obviously very lucky to have made it, but I'm thankful that the LCO TGB did move to evict this family that has been a bit of a problem since they got here. And that is really when the gun violence started to pick up. And so I'm hopeful that things will start to turn to a better page.
Were they able to apprehend the person who perpetrated this crime?
It was another juvenile. We do have that juvenile in custody. It is believed that the juvenile who did the shooting, his uncle may have also been involved in some capacity, and he was taken into custody. But I believe the uncle was released on a signature bond today. Any other questions on that?
You might as well, I guess we have just a little brief update on, we're moving forward. Yes.
So we are in the process of hiring for our truancy position, which is new to our diversion program. Is that posted, or it will be?
Will be.
Very shortly. We are also in the process of working with Sorona, which is the program we have contracted through for one of our grants that we were awarded. They are going to be kind of the main people in charge of hiring a couple people on the diversion program, but we are still very involved in what the programming looks like there. So we're moving forward with that. I also met with LCO today with Judge Smith, and we talked about how this truancy and diversion program could potentially benefit them as well. Elaine is open to, we're going to start with 10-day drops. So any kids that haven't attended school for a consecutive 10 days, those kids generally get dropped, and typically they've been falling through the cracks with no follow through. So now this program will be able to help pick up those pieces and hopefully get the family to follow through with either enrolling to a different school or working with our program to help, I guess, support the family and help them learn to, whether it's communication is better, whether it's enforcing consequences or rewards, helping parents really feel more empowered. I think they rely on the county a lot when it comes to having to parent their kids who have obviously come into some significant behavioral problems. So trying to give them the power back that they should have is what we will be working on.
Do you have an idea of how many children are truant?
In Sawyer County, I know that this is definitely a major concern for our community. I think the message has been lost that going to school is the law and you cannot legally drop out until you're 18, because there's been nothing up until this new program to really help enforce that. And so there have been a lot of kids that have dropped out at an earlier age than 18. And what we're seeing is it's a generational cycle where the parents didn't finish school, maybe their parents didn't finish school, and they've really lost the insight of how important an education is. I don't know the exact numbers.
I'm gonna find out really quick.
Okay.
Yeah, once you start receiving those 10-day drops,
Yes.
we'll have a better idea of what's coming in.
And those are the more chronically truant. There's still going to be some that maybe don't rise to the level of getting referred to the program. And that is because there may be issued a citation, and that citation was enough to either get the kid or the parent or both back to, okay, this is serious, I need to go to school. Sometimes that does work. What the program is really designed for is for the kids that it's consistently not working. Any other questions?
Thank you.
Okay. We also had the children in care report in the packet, and nothing unusual or outstanding on that as well. Economic support. Shauna has provided her standard report, and she didn't have anything outstanding at this time to bring forward. Any questions on economic support?
Call numbers have gone down.
Little bit. Over time, though, as I look at it, it's been, yeah.
A lot.
Yeah, yeah. Okay.
All right, public health report. Julie?
Just a couple of updates since I submitted my written report. We are seeing quite a bit of influenza and other respiratory illnesses right now. Our local providers are reporting that to us, as well as emergency room data and wastewater data is also showing those elevations in respiratory illness right now, and pretty significant increase within the last week for sure. I did want to highlight Medical Reserve Corps. I did have a written update here, but since this report was written, we did receive word from the state that we received another $20,000 for our MRC Strong funding. And also we were awarded a NACCHO $10,000 grant for MRC. It's the Operational Readiness Award, and that's to continue our volunteer management operations. For community health assessment process, the survey data as well as the stakeholder data has been compiled, and the steering committee is meeting. We met once in December, and we meet another time next week to prioritize our next steps for the next 3 years. Any questions? Thank you.
Okay.
Next would be the budget performance rollout.
Did you want to add anything, Carrie, or are you good with me? Just wanted to check if there's anything. We've got the roll up here. We tried to put in, we pulled it so that it's pulled through December 23rd. So next month should be a little cleaner recap of where we're at, because we're still waiting for revenue to come in and close out a couple things. One of the things that has come in, and it does not show on here, is our WIMCR dollars. And I'm going to be bringing you back to a number of meetings ago when we talked about community support program, crisis intervention, targeted case management, anything that we kind of bill for MA services for. We provide information to the county, to the state to help make us whole on that other side of it. When we talk about CCS, it makes us 100% whole. When we talk about CSP and crisis intervention, you guys signed a resolution to help support that the state would make us fully whole on that. So some of those, so anyways, we did get some payment back on that. And it is reflected of the work that happened in 2023, so it's always a year late. And so it's looking like we have about 360,000 that is coming in on that end of things. So that will help support some of the budget. And then we know we have some outstanding billing on any other MA billings such as CLTS, CSP, crisis intervention, birth to 3 will still have billing that occurs in funding coming in. So we'll get a better look at that. As far as our expense totals are looking, we are coming out fairly close despite overspending quite a bit in youth justice. But we still haven't taken some of those revenues from like the fund balance and different things. So I'll see where everything plays out and have a better look at that next month for you guys. Did anything else? Oh, and then I did kind of change up that look a little bit. I noticed on some of the reports, it really wasn't a clear report. So we kind of made the budget performance report and then each of the units to be kind of the same kind of look instead of a different look. So hopefully that's a little bit more understandable as you move forward. And then the one piece that will probably be changing up a bit going into 2025 is the receipt recap and the purchase service recap. Thinking about trying to make things a little bit more specific to the service line so that we can kind of see a little bit clearer what's happening. Any questions for us on that? Okay, I can kind of run through some of these. And then that's the report. These two reports are what we're looking at changing up.
So thinking back to the budget that we approved, some of these cost overruns then were addressed.
Yep, should be addressed in there. Mhm. I think specifically we definitely shifted the budget for CPS and youth justice. So that's the major areas.
Okay. Any questions? Any committee updates? We did talk about a long time ago about a list of acronyms that was going to be brought up to date so that everybody knew what all these abbreviations were for. If that.
Yep, I have that sitting there and I forgot to add that. So
Okay,
I could get that.
it would help me. Then I wouldn't have to search.
And it's mainly like the ones that you're seeing on the reports all the time.
Yeah, and all these little things you
All these-
mentioned.
Yes. Yes. Or even what a purchase service recap is, those kinds of things too. Okay.
Gotcha. So is there anything that anyone wants on the next agenda? Anything different?
We were just gonna have that update, so on the transportation.
Yeah.
So we'll make sure that gets
Andy?
added.
I was gonna ask Marshall, did you bring your raffle tickets
What?
for the Senior Resource Center?
I don't have anything, no.
Okay. If you just note that I've seen them, somebody's selling them in my office. Just Senior Resources,
Yes.
doing a fundraiser for their
Their roof.
roof. Like there's an event coming up in a couple weeks.
Exactly, yeah.
So, yep, and I think those are getting, so anybody who's listening in on this, those should be posted around the community. And even if you can't attend, if you can purchase a ticket.
Excellent. All right. Anything else? Let's adjourn.
Okay, thank you.
Thank you.